warm welcome to the program Healthy Living on Trust Television. I'm Aisha Salihu. Today we delve into a critical issue affecting our nation, the alarming rise of drug and substance abuse among our youth population, which has predisposed them to addiction and disorders. Join us as we explore the factors contributing to this menace, learn about effective management procedures, and gain insights from an expert therapist on the way forward. Nigeria is facing a significant challenge with drug and substance abuse, particularly among the youth. This issue affects not only individuals, but also families and communities. According to recent studies, drug and substance abuse has reached alarming levels among the Nigerian youth. There are various factors contributing to this issue, including peer pressure, lack of awareness, unemployment, and a sense of hopelessness, among others. This facility is one of the many facilities that offer psychological services where people dealing with addiction and disorder from drug and substance abuse access help through counseling and other management measures. Dr. Bright Oris, a therapist at this facility, says to curb the menace of abuse of psychoactive substances, addiction and disorders resulting from these must first be seen as a challenge, and use of stigma words such as abusers, addicts must be stopped.
So substance use disorder is like the problematic use of substances that spans over a 12-month period. But then it has to meet certain criteria, and there are a list of it. So it spans over a 12-month period, and then the person has to exhibit an increased use of the substance, the amount of the substance, frequency of use of the substance, there's a cravings to use the substance. Then the person uses the substance even when they know that it's harmful. They use the substance even when they know that it affects their physical health. They use the substance even when it affects their social life. They use the substance even when it starts affecting them meeting obligations. For example, work, school, family obligations. So there's time spent seeking out the substance or using the substance to recover from the effects or whatever effects. So there's also tolerance. The person uses more of the substance without feeling the effect. And then for the person to get the desired effect, the person has to use more of that substance to get an effect that it previously got before. There's also the dependence, where the person feels the compulsion to always use the substance. And if the person doesn't use the substance, there is some physical responses. For example, the person might become tremulous. The cravings might increase. So if a person is having all of these, at least two of these, within a 12-month period, then we can say that person has a substance use disorder, an addiction. When we talk about substance, if I go on to categorize the psychoactive substances, you find that it's not just restricted to the youth population. Of course, it's high in the youth population. Alcohol is also a substance, nicotine is a substance, and people get addicted to them, right? Why is it prevalent in the youth population? I think it's pretty obvious. Energy, youthfulness, peer group pressure is more within the youth population. The curiosity, which is why some people start using substance in the first place. Curiosity, the need to fit in socially, and recreational. You go out parties and then you need something to lighten up the mood, or a party drug or something to use during social gatherings, social circles, and that's why it's quite more the youth population. You hardly find 60-year-old men, trying to host a birthday party and then they're looking for. So we know that there's more activity in the youth population, and hence why the addiction to different substances tends to be higher within the youth population. Addiction in itself is a mental health disorder. It is. Substance use disorder, it's a disorder in itself, right? Mental health. Addiction is a disease, and we classify addiction as a relapsing brain disease that is characterized by the compulsive need to use substance even when it's harmful, right? So it's a chronic relapsing brain disease. So if we're looking for the mental health disorders that are caused by substance, there's substance use disorder in itself, and then there's substance-related mental health disorders. For example, psychosis. Some kinds of psychosis can be triggered from the use of substances. and it's mainly because of the use of the substance. There's also depression, right? Those can be caused as a result of the use of the substance. But most times, those kinds of disorders are usually underlying. For example, there's a psychotic disorder like schizophrenia, for example. It's usually underlying, and then the use of substance kind of triggers it, I would say, in some way. But substance use disorder in itself is a mental health condition that should be managed. Addiction is a mental health condition. It's a disease that should be managed in itself.
Drug trafficking and its use are on the rise in Nigeria and are becoming a public health concern. The enforcement agency says that the drug menace is leading to many criminal activities. Nigeria's drug watchdog told WION that over 19,000 arrests were made in the last 20 months and around 5.4 million kilograms of illegal drugs have been seized across the country.
We have 14.3 million Nigerians who abuse illicit substances. And out of that, that's which gives you 40.4% prevalence rate. And that gives us, which is 3 times the global prevalence average of 5.6, almost 3 times the global prevalence average, which is 5.6. And so when you look at that, it is a big challenge in Nigeria, the problem of drug abuse. There is no need denying that.
The most common illegal drug used in Nigeria is cannabis, mainly in its herbal form. It is locally produced all over the African region and is therefore affordable. The possession of cannabis is illegal and is punishable by a minimum sentence of 12 years in prison. In serious trafficking cases, life imprisonment may be imposed. There have been calls by experts and some government officials to legalize the cultivation and the use of cannabis. They say its health and commercial value is beneficial to the country. However, the drug watchdog disagrees.
Cannabis remains a threat to human health because it causes psychosis, leads to some health challenges. There is no need denying that. People who are promoting cannabis may tell you, yeah, it has this, it does this, it does that. More often than not, they keep quiet about also the dangers, what cannabis can also do, the harm cannabis can also do to the body, to human health.
Despite the stigma and danger of the law, the use of cannabis in Nigeria is growing. Studies show that it ranks just below alcohol as the second most used psychoactive substance in the country. There are an estimated 14.3 million active drug users in Nigeria. The number is likely to hit around 20 million drug users by 2030. This according to an estimate by the United Nations Office on Drugs and Crimes.
The chairman and chief executive officer of the National Drug Law Enforcement Agency, Brigadier General Mohammed Buba Marwa, lamented that more than 14.3 million Nigerians aged 15 to 64 years use psychoactive substances other than alcohol and tobacco, thereby constituting grave danger for the future of youth in the country. He added that the most disturbing revelation was that 1 out of 4 drug users is a woman, while 1 in 5 persons who use drugs in Nigeria are suffering from drug use disorders, stressing that drug use is most common among the ages of 25 and 39 years. He observed that the prevalence of drug abuse among the youth in the country was responsible for rising cases of prostitution, kidnapping, armed robbery, terrorism and banditry, noting that the drug users under its influence commit all manner of criminality, including contracting HIV and AIDS, as well as mental health diseases. While quoting a report by the National Drug Use Survey conducted by the United Nations Office for Drugs and Crime in 2018, Marwa disclosed people who inject drugs constitute a sizable proportion of high-risk drug users in Nigeria, as 1 in 5 high-risk drug users is injecting drugs. He explained that drug abuse refers to the consumption of drugs in a manner that deviates from approved medical or social norms and can lead to negative physical, psychological, and social consequences, pointing out that drug use in Nigeria cuts across all ages, gender, religion, socioeconomic status, and regions. Buba Marwa said the National Drug Use Survey conducted by the UNODC 2018 revealed that about 14.3 million Nigerians aged 15 to 64 years use psychoactive substances other than alcohol and tobacco. The most common drug of use is cannabis, followed by pharmaceutical opioids, cocaine, heroin, etc. Another disturbing finding of the national survey is that the fact that 1 out of 4 drug users is a woman, while 1 in 5 persons who use drugs in Nigeria are suffering from drug use disorders, and drug use was most common among the ages of 25 and 39. People who inject drugs constitute a sizable proportion of high-risk drug users in Nigeria, as 1 in 5 high-risk users is injecting drugs. Drug and psychoactive substances are substances that, when taken, exert major action on the brain and the spinal cord and are classified as depressants. These substances depress the central nervous system by slowing down the activity of the brain. They are often medically prescribed but are abused for their intoxicating effects. Examples are alcohol, heroin, cough syrup with codeine, morphine, pethidine, and methadone, among others. The National Drug Use Survey 2018 revealed that an estimated 4.6 million Nigerians had used opioids such as tramadol, codeine, or morphine for non-medical purposes. The non-medical use of cough syrups containing codeine and dextromethorphan is estimated at 2.4 million people. A new report by the United Nations Office on Drugs and Crime says the Nigerian market tops the list of cocaine smuggling regions in Africa. In the Global Report on Cocaine 2023, the UN agency said the steep growth in supply has been marked by a similar swell in demand. It said Nigerian traffickers often work in collaboration with their compatriots in other countries, particularly members of cult groups in European destination countries and those operating in Brazil. The report noted that the role of Nigerians, however, is relatively important at mid-level and dealer levels rather than large-scale trafficking. Although in September 2022, the National Drug Law Enforcement Agency (NDLEA) seized 1.8 tons of cocaine worth 194 billion naira in Lagos State. The NDLEA said seized drugs appeared to be the biggest singular cocaine seizure in the agency's history. We'll go on a quick break now, and when we return, the program continues. Stay with us. Welcome back. If you're just joining in, this is the program Healthy Living on Trust Television, where we have been shedding a light on the menace of drug and substance abuse and its resultant effect on the youth population. Let's hear from Dr. Bright Oris, an expert therapist at Olive Prime Premium Psychological Services, on the management techniques for addiction and disorders from drug and substance use.
For substance addiction, of course, we know that people can be addicted to a few other things, like people are addicted to sex. There's porn addiction, there's gambling addiction, but this has nothing to do with substance. So with substance, addiction is a disease, and how is it categorized? How do we say something is a disease? So the thing has to change the person's body function physically or physiologically, right? So there's a change. And with addiction, we see the change. So if you take someone that is addicted to a particular substance, let's say cocaine, for example, the brain changes in some way that you would know that this person is addicted to this substance, right? Same way if somebody breaks their bone, you could do an X-ray and you find out. So these are things that point out to addiction. Then there is the symptoms. That's what they feel, like cravings. They feel the compulsive need to want to use the substance. It's a symptom of addiction. Cravings is a symptom of addiction, right? So this is how you know that somebody has an addiction, right? There's a cravings, there's a dependence that comes with it. The person feels the need, compulsive need to want to use a substance. And then when you give the person that substance, they feel better, right? They feel better. So it means that the substance was now used to manage the cravings or whatever they were feeling, the restlessness and all of that. You know, there are genes that can be passed from family to family that predispose a person to addiction to a particular substance. For example, alcohol. It has been seen that there are genes that can be passed from an alcoholic parent to the child, and then the child might also develop alcohol use disorder. So, but the specific genes have been, I know that specific genes for alcohol has been identified that can be passed, but I don't know about other substances, if research has been done into them. But yes, there is genetic factor that predispose. That's why you see 10 people take the same drug for recreation or the first time, but not all 10 people go on to become addicted to that substance, right? So what makes that difference? That one person gets addicted to this substance and the other person who also took the same amount of this substance did not get addicted. I would like to put cannabis in, it doesn't neatly fit into certain categories of psychoactive substances, like stimulants, like the cocaine, amphetamine, methamphetamines, you know, like the depressants, alcohol, you know, or like the opioids, like codeine, morphine, and all of that. Cannabis doesn't neatly fit into all of that because in certain amounts it can be a depressant, in certain amounts it can be a stimulant, in certain amounts it can be a hallucinogen, right? So I think the conversations around cannabis is a lot more political, which is why we see that there are certain parts of the world that have legalized the use of it and they control the use of it, right? That's why people say no, it's for medicinal purposes. And yes, there is still research going on that area, but I know that it's being used in certain countries that it has been legalized in those countries for certain conditions, for example, glaucoma, increased eye pressure. It's seen that the use of cannabis reduces the eye pressure. It has been seen to reduce tremors in patients that have Parkinson's. So these are researches that are still going on, which is why there's a whole conversation going on around cannabis. But it's a psychoactive substance, and every psychoactive substance has the potential to become addictive, which is where the issue is. It has the potential to become addictive. And like all addictive substances, it will come with certain behaviors that affect the person, that affect the families around them, that affects the economy, that affects the social life of the person, right? So I think this is a conversation that are still ongoing in the world. Cannabis in itself doesn't neatly fit into, so there are like four major categories of psychoactive substances. There's the stimulants. They increase the activity of the central nervous system. There's the depressants, like the opioids, the classic depressants, they are depressants. Benzodiazepines, alcohol is a depressant. We have GHB, we have Rohypnol. Those are depressants, psychoactive substances. Now, for cannabis, marijuana, it doesn't neatly fit into these categories. Where you see someone that is taking it and the person is becoming hyper, another person is taking it and the person is becoming low. Another person takes it, the person is hyper, another person takes it, the person is sleeping and feeling dull. And while one other person takes it, the person starts hallucinating. So also the quantity that is being taken, the route of administration that the person is taking the drug through. For example, somebody that eats it, that ingests it, is likely going to get the depressant effect, right? That's why people use it in doing brownies, in cakes, use it to cook food, because they are expecting a particular reaction from it, and it can depress. People that smoke it, right? It can depress, it can increase the activity of the central nervous system. So marijuana itself doesn't neatly fit into this category. That's why someone else can take it and have one effect, another person takes it and has another effect. But there are some other drugs that if you take it, this is the effect. It reduces the central nervous system and increases it. It's not about how you feel about it. It's just what the drug does. But marijuana is not one of them. So I believe that same way you have alcohol, right? Alcohol is a psychoactive substance. Caffeine is a psychoactive substance. Nicotine is a psychoactive substance. And then we know that smoking causes cancer. And then if you look at this, a pack of cigarettes, you will see it. This is smoker's lungs. This is healthy lungs. But then they're still selling it, right? So should there be control? Of course, I think every drug medication that has the potential to harm a person physically or physiologically needs to be looked at, and there needs to be some form of control for such substances. That is my belief, because apart from that, smoking in itself brings a lot of health risks to people's organs and systems. So if we're going to debate the moral part of this drug, I think it's a conversation for every other person to chip in. But the science of the drug, this is what the drug does. What you do with that information is left with people that are not scientists. And if we come from that point where we understand that addiction is a chronic relapsing brain disease, our approach to it would change. It's like somebody that has hypertension. Hypertension is a chronic medical condition. Diabetes is a chronic medical condition, right? Addiction is a chronic medical condition. Let me just tell you how psychoactive substances work, so you understand why people tend to go back and still take them. So, most psychoactive substances work by triggering the release of dopamine. That's like the reward pleasure hormone, dopamine, right? Now, if normally you eat food, or have a drink, or have sex, do something enjoyable, you get a reward from it. You get some kind of pleasure from it. Now, what psychoactive substances do is that they act on that. And that pleasure you get is from dopamine. And what dopamine latches onto these experiences, it tags these experiences as survival, life-sustaining activities. Which is why you see, even though you go to the poorest of places, you see people still procreating, having sex. You see people still eating food, because the brain tags such activities as life-sustaining. And when the brain tags such activity as life-sustaining, it's do it again. This is life-sustaining, do it again. Do it again, right? Now, what psychoactive substances do, any psychoactive substance, for example, marijuana, what it does is that whenever you take it, it causes the release of 10 times the release of dopamine that you get from eating food or having sex. So, and then the brain tags it as life-sustaining, do it again, repeat it. So the person goes back, does it again, repeats it, 10 times more dopamine, and the brain is saying, yes, life-sustaining, do it again. Do you understand? So, and the more the person that does it, the brain stops producing as much dopamine as it would produce from normal, natural, pleasurable activities, right? So the person that feels the need to always go back and take the substance, And there's a progression for this. First is the experimental use. The first time they took marijuana, the first time, there was a reinforcement. And then they went to occasional use. They don't take it every time, but when they go out, hang out with friends, they take it. Some people end there in their use of psychoactive substances. But then some people go over to regular use, where they begin to seek the substance by themselves. And then the compulsive use, where we now say the person has now become addicted. So there's a progression of use. If you take any psychoactive substance for the first time, you do not automatically get addicted, right? So also, like I said initially when we started this conversation, 10 people will take this thing, but not everyone will go to that point where they now use it regularly or have that compulsive need to use that particular substance. So how did we get here? That people want to go back and take it? The dopamine. It reinforces that pleasure. And when dopamine is released in such high amounts, the effect in some of the brain centers is that it gives that euphoria, that trips. So how do you want to tell somebody that the brain is saying this is pleasurable, this is life-sustaining? How do you want to convince the person otherwise? So it's not a personality problem. This is exactly what this substance does. Each medical condition, especially the chronic ones, there is management for them. So with substance use, we usually don't say treatment, we say management. Because like I said, addiction is a chronic relapsing brain disease. So you need management. And you need people that are skilled in that area to actually manage. But first, we need to remove the stigma from it. So people are saying, it's still seen in a lot of climes, especially in Nigeria, it's still seen as a personality problem. It's still seen as bad habits. It's a disease. This person has it. So what do you do for people that have certain medical conditions? You manage them, you treat. That is what you do. We know that first and foremost, abstinence is the mainstay of managing abstinence. The awareness has to start. Because when people understand that this is actually a disease, the view of it changes. The view of it changes when people know that this is a disease that can be managed, can be treated in XYZ ways, right? So awareness is where management starts. And then we start managing other areas. For example, if there's a comorbid underlying mental health condition like schizophrenia, and then that is being treated. If there's a comorbid depression, that is being treated. And don't forget, some people take stimulants because they're already feeling depressed, so they need something to make them happy. So we're able to treat these other comorbid and these associating conditions that these people have. And you know the funny thing, people that have chronic medical conditions, they will end up with one mental health problem or the other. And then they might begin to use substances as maladaptive coping mechanisms for these things. And then if they are predisposed to developing addiction to a particular substance, they will also develop addiction. So the management is coming from that holistic point. So the chances of relapse in someone that is addicted to any substance is there. It is the nature of the disease to relapse. Do you understand? So when we know this, our approach would be different to it. It means that yes, it's just like, what is hypertension, right? The blood pressure will be high. A person can be on medication and then something happens one time, the blood pressure is high again, right? So is there a problem with the person? No, there's no problem with the person that is addicted to any substance. They have a medical condition, right? And the chances of relapse is always there. That's the truth. So that when you see that the person relapses, there are people that relapse 2, 3, 4 times and they've gone to rehab. And it feels like, oh, they're not really treating them well because we're looking for a cure, not management. And of course, with much better strategies in rehab, the recovery might be much better for the person. There's also involvement in family. Like all mental health conditions, addiction is one that you cannot treat or manage in isolation. And this is with all mental health conditions. You cannot manage them in isolation. You need social support around the person. You need a healthy environment around the person to manage the condition. There needs to be some lifestyle changes. The person needs to make lifestyle changes. So you need to stop being around places, high-risk places where they are taking XYZ substances. You need to watch your access to XYZ substances because these are the risk factors that predispose you to using again and then a relapse, right? So if you ask me why people go to rehab and then they're discharged and then they go back to using, the nature of the disease is that it relapses. But what we can do differently is to come up with different coping strategies, mechanisms to prevent relapse.
By understanding the causes, consequences, and available support systems, we can work together to combat this problem and create a healthier Nigeria. Remember, if you or someone you know is struggling with addiction and disorders, seek help immediately. Reach out to local helplines or healthcare professionals who can provide guidance and support. That brings us to the end of today's health program. We hope that this discussion has shed light on the pressing issue of addiction and drug abuse in Nigeria. Remember, addressing this problem requires a collective effort from all members of society. If you have any questions or would like additional information and want to share comments, contributions, please visit, subscribe, and like our website and social media platforms. Together, we can make a difference and build a healthier, drug-free Nigeria. I'm Aisha Salihu. Thank you for watching, and we'll see you next time on our health program.